Good day and positive vibration. This is Major.
And I'm a Cody Speaks.
And I'm in Jamile.
Peace and blessing. I'm rolling.
And welcome to Concern versus Podcast, where we talk about issues surrounding our community, various issues. And today we're talking about a real issue that I'm not gonna lie, I was very naive about, but black maternal health.
I hadn't realized worldwide how Black women were suffering when they gave birth to children. And it is concerning because this is across the board. It is not only in what you would consider poor countries, it is in high income countries as well.
Come up with this grand study saying that all of a sudden Black women are having a problem giving birth when in the past 10 years, the studies have also stated that women of the European persuasion, primarily Caucasians, are on the decrease as far as their population or their birth rate. They're the ones that's decreasing in birth rates. So now all of a sudden you have this study that says that, actually Black people are having a hard time giving birth when we always had midwives. We never had prenatal pills. We never, we gave birth to many children, 12 children in the house.
As there's research, particularly by Black health professionals, regards this situation, then we'll never know the crux of what's going on, the gist. And that's the issue. Even right now as we speak, Cody and Roland shared some facts that we all know about queens that had 10 and 15 kids, right? And that was mainly back in the day. And like Cody said, which is true, the birth control thing is a big thing. And like you said, Jim, they about sterilizing women. And what I noticed is always been, and see, this the biggest issue I think in our community. We so easy to be targeted because we already segregated in the States, particularly. You have predominantly white neighborhoods, you have predominantly Black neighborhoods, and you have the poor Black neighborhoods, and they set up shop, with the vaccinations, with the flu shot and all of that.
I'm glad we really having this discussion. This discussion is needed because before you go into the facilities, we was doing it ourselves. Women was having children. But now when you go into the facilities, the queens are dying out. That's what the stats say. So we got to examine these things. When somebody it's one of our family members get pregnant, we have to start discussing this with them and share these things with these, because so far I haven't seen too many my family members, friends, and associates pass from this. But when I do know that they do give them birth control, give them this shot, put something down in their wombs because they want to stop the childbirth, stop the African childbirth.
There's so many things I want to talk about. See, as my people just stay suffer now. My country bad and my country harder now. Nowhere to go and there's nowhere to run. But I no go mind.